in the implant window opening. Okay, so here is what I have. There are 4 dots here. And I'm going to follow this 4 dots to connect them to make a window opening, which will give me approximately, let me see, 1 centimeter long by, looks like half a centimeter tall window, which should be adequate for good access, and I'll have plenty of room for the curettes to get in there and elevate the Schneiderian membrane. So as you can see here, there are 4 dots here that I created as an outline for my window for the sinus opening for the osteotomy, and I'm going to continue with the same with the same tip. It's a diamond. Kind of round, almost looks like a large round burr diamond tip. Alright, so here's what we're looking at right now. There we go. This line, you can start seeing that the bone actually changed, the color here has changed from kind of ivory. You start seeing a little bit of a gray area right here along this osteotomy, along this cut. This is telling me that we actually have removed, here it is, I'm going to wash it off a little bit and see. You can clearly see that there's a gray shadow, gray line showing through this osteotomy. This is telling me that the bone has been removed, and we're actually getting very close to the sinus membrane right now. So I'm going to continue gently in this path here. The objective is not to push through the bone, but actually remove it with piezo action. So it's a gentle sweeping motion with very little pressure, just very, very little pressure. This is the inferior portion of that osteotomy. This is the two lower dots that we outlined initially, and what you see here is and flush this a little bit with water. You can clearly see the difference in the color of the surrounding bone. It's nice and ivory bone color with a gray line right here. This gray showing through the osteotomy site tells me that I'm actually close to the sinus itself, to the Schneiderian membrane. The bone has been removed, or whatever the residual bone is still there is thin. So right now I'm going to continue with the same tip on the piezo unit, the round diamond tip, gently, almost no pressure at all, just sweeping motion along this line until I actually get a good gray shadow telling me that I'm close to the membrane. I will at that point switch to a different tip because I'm anticipating that there is going to be thicker bone in this area, and definitely thicker bone. You know that the bone there is going to be actually quite thicker. So I will use a little bit more aggressive tip, something like a bone cutting, like a bone saw type of tip. It's a very nice and clean outline for the osteotomy. Again, this is not a fast surgery. It's very gentle, very conservative in terms of tissue management. And now I'm going to go ahead and change the piezo tips to something a little bit more aggressive. Okay, so I'm switching to a bone saw tip. You can see that it's actually quite aggressive. It looks like a miniature saw, and it's going to be actually quite aggressively cutting tip. So I'm going to be super gentle with this. I want to connect these dots here, and then I will choose. At that point, I will choose whether I'm going to continue with this tip or I'm going to switch to a flat end diamond tip. So for now I'm going to start here on this vertical sections. Again, very little to no pressure, just gentle sweeping motion on a smaller scale, obviously, but it's still same concept.